outside.
Mm-hmm.
Change center.
Yeah.
Why?
And it's just figure with the with how much more daylight we have now, it's I like it out here. I like when the boys go to sleep in the afternoon and I spend that hour out here, hour and a half out here. It's so nice.
Done a lot of work to this backyard.
Mm-hmm. Yeah. We'll see how next week goes if he's if Carlos starts on the rocks and everything in the fence. And I'm pretty sure he could fix our other gate too,
Yeah, it'd be great. But it's come a long way. It's from dirt.
Yeah.
Just being dirt back here, so it's fun to see what the vision has, really, whatever vision one of us had, and we built on it. It's nice to have it, just be able to see ourselves back here and memories of the place. So I'm glad you're spending time back here. I need to spend more time back here. So this week, got some answers. This week, this literally a day. Yesterday. It feels like it's already been a week. So
just last week we've got it.
Just last week in the last 12 hours. So confirmed a polyp, which is causing our fertility issues, and surgery scheduled.
Yeah. So it was, what's the procedure called again? It was the
water sonogram.
Water sonogram. Yeah.
Yeah, there's another name for it, but that's essentially what it is.
Okay. And so maybe you just, what was like, you just showed up to the lobby and checked in?
Yeah, just showed up. It's a really quick exam. They just, it's similar to a pap smear for those that know what a pap smear is. You just go in and get, your legs in the stirrups, and they check your cervix. And in order to do that, they have to use a tool to pry you open. And then this was different than normal, like pregnancy ultrasounds. When you're very early, you get what's called the transvaginal ultrasound, where they go up with a wand. And so similar to that, but they actually go in with this long tube, and there's a camera on the other end of this tube, and they slowly insert it with like a straw, and the straw is filled with saline solution. And while they're kind of looking around, and they're pushing water through, so it could fill your uterine cavity up with water, so they can get a good view of the water space that it fills up is essentially all clear on the ultrasound. And if there's any abnormalities, they show up as black. So, of course.
I imagine it's like a dual pain, right?
Yeah, kind of. I mean, honestly, because I had 2 babies, I feel like there was no pain for me. And she said that was very common. The only pain that I felt was at the beginning, when they're trying to get the tool in to look at the canal, to go up in your uterus. And I think that's probably specific to me because I have what's called a long and narrow uterus. And so it's like really hard to get to. And so just using like a longer tool, it was uncomfortable.
Yeah.
But the actual inserting of the camera, the straw, the other things, the actual solution, I didn't feel any of it.
Okay.
Yeah. So.
Did she have a screen so you could see it?
Yeah, 100%. Yeah. So every time I've gone to this facility, they've always shown me and talked me through everything that they're doing.
That's great.
So it's so reassuring and honestly just really helpful from like totally knowledge gap for me, like all of this stuff, right? I don't do this on the regular, right? So just talking me through what they're looking at. And I mean, I felt like every time we've gone in there for the boys when they were in utero, like it's like looking at an alien. To like, holy shit, what is this, right? So I think it was really helpful to talk through, and then honestly just get like really comfortable with the anatomy, right? And understanding like, okay, why are things the way that they are? And I don't know, it just brings more like awareness to it in the sense of um, understanding why we're having the troubles that we're having and what it looks like. That's super helpful instead of just, I don't know, maybe drawing my own conclusions or like, if they were to tell me like, oh, without seeing it, like, oh, you have a 1 centimeter growth on your uterus, and this is exactly the spot where, the embryo wants to implant. I mean, just visualizing that without seeing it, I can only imagine what that must look like super scary,
Yeah.
like
Yeah.
huge, way bigger than 1 centimeter, like holy shit, a growth? What is that? Type of thing. But actually seeing it and seeing how small it is and like then just completely talking me through that this is the most common thing and it's
Yeah.
very easily removed, and once that's removed, like very
So like it's like a skin tag, like just like a
essentially,
like
yeah, it's like
something that small can have.
yeah, but it's more so the placement. So the placement of the polyp is on the very top of the uterus, and that is like 98% how it's been explained to me. 98% of the prime real estate for when you do implant with an egg, a sperm and egg. That's where the embryo likes to implant because there's ample blood flow and things like that. And it's just a really cushy, like I said, prime real estate spot.
Yeah.
When you have something even as small as a polyp or maybe even a fibroid, there, one, the embryo won't implant there because it feels like it already knows there's something else taking up the space there. And two, the way that she showed it on the ultrasound, she looked at blood flow and she said that there was not ample blood flow going anywhere around that area because it likely was going all to this polyp, and that signals to the embryo that like this is not it's a hostile environment, so not a viable, environment to plant and grow. So it's in their mind very, very likely that this is what's causing our issue, and incredibly common is what she told me. Now, people can get pregnant with polyps all the time, as well as fibroids and other things like that in the uterus. But again, the location of the polyp is what's likely causing the most amount of issues. So,
Or is it seated like
on the very top of the uterus.
very top? And she said that even though we got pregnant those 2 times,
Recently,
it can cut off blood flow,
correct.
and that's leads
So,
loss, right?
and it's very likely that the embryo implanted somewhere else on the uterus, and it wasn't getting what it needed in order to sustain itself. So it just decided to no longer be a viable pregnancy. Like the body's really smart like that.
Yeah, I know. Yeah, that's right. Right. We talk about that too. Like how it's your body telling you it's not viable, right? It's not. Yeah. It just reminded me. I forgot to call them too today to ask if we could try this cycle, right?
Yeah, we can always shoot them an email.
Yeah,
they're working more.
That's right. They work on for yours. Well,
yeah.
I need to research it anyway too. Just I'm sure there's more.
Me too. I need to research to ask more questions. Like, God, this is like, what do we do before AI? And even though it's not foolproof, it's like still helping us.
Yeah.
It's light years above.
Yeah,
Google,
it's really
MD,
helpful. Yeah.
Or WebMD, and really understanding. We're not the only ones asking.
Yeah.
ChatGPT or Claude these are questions, and so it's helpful the more answers it generates, right? So
Yeah.
just for us to formulate questions specific to us that we don't even know that we have yet,
Yeah. And so you're scheduled early July, right? It's just like an hour. Did they talk you through that when you scheduled it?
So we're gonna. No, they didn't. Actually, I didn't talk to them about anything, because the scheduler just did everything through. Like, okay, tell me when your next period is, and it's like, Okay, I'm guesstimating it's this time. And then she's like, okay, we'll just do it the day after. And she said they'll schedule me a few days before to talk through the procedure, my questions, face to face, probably give me like a visual of what it's going to look like. And yeah, so we should definitely get our questions answered before that, with our concerns like around the reserves and stuff like that and impact. But
Yeah,
on
because
it,
they said did they say what the risks or like so removing the polyp can also like damage or remove some of the eggs too?
yeah, so removing the polyps for whatever reason has an impact on your reserves, your egg reserves. I don't know how. That's what we need to ask. We need to understand because they give you two choices. They say if you're going to go through fertility treatments such as IVF, they don't want you to go this route. And I think it's more so about wasting time, meaning they want you, if you're going to do IVF, they want you to go and do an egg capture and try to get as many eggs as you can. Versus, I think this route, and this is my speculation, I haven't looked into it yet, but we are foregoing this round. We're foregoing the next round of trying. So those are eggs that I think we're like wasting, you know? And then who knows how many rounds after that. Like, I think what they want is they want people to commit to one and not just like, okay, it's your choice. Like, they have factors that say like, no, I think you really should go the IVF route. Let's not waste time. And then they have me where they don't think that that's like, they think my reserves are low, but they're not alarmingly low in their mind. Especially given we had just conceived a few months ago, back to back, right? They know that there's, the quality of them must be decent enough, right? And they highly suspect that the quality of the eggs was not what was causing them to stop growing and maturing, but more so this hostile environment, such as the polyp. So I think that's the definition of the of the like they don't want impact to the reserve. I think it's a matter of you're doing dummy cycles in order to get to your final destination versus we wouldn't be doing the surgery. We would just be going straight for egg retrieval.
Yeah.
And they want to take as many as they can because they don't know how many are of good quality. Does that make sense?
Yeah, but the egg retrieval is a separate like.
So it's one or the other.
Yeah.
Yeah.
And they said that if we were leaning towards IVF or if we wanted to do IVF or
they would not suggest this. Yeah. They would pause this and go straight for the egg retrieval.
Interesting. Yeah. That's tough, right?
Well, it's not because I really trust them. I mean, they see this every day, all day. And if they say this is like pretty much they can't give 100%, guarantees, but they're very, very, strongly leaning that this polyp is what's causing the issue and that we will likely have no other issues after that. They don't think that us going through IVF, spending a fortune on, egg retrievals and things like that for it to possibly not work for whatever reasons. IVF has its own issues, right? Versus conceiving naturally after removing a small adhesion, that's causing a hostile environment. And it's not even a hostile environment. It just is it's like the body knows there's a foreign thing that shouldn't be there. And so it's not going to, safely like let the embryo thrive in that. So yeah. These birds.
Yeah, I know. Yeah, that's tricky and tough.
It's not though. I think you're thinking about it maybe. Well, talk me through what you're thinking about that is feeling like it's a tough decision.
I guess well, like you said, we don't know, but I'm worrying about the risk to the eggs, right? How damaging that could be, and then
I don't.
we would essentially be, go ahead.
I was just gonna say I actually don't think that there's a risk to the egg reserve. I think it's a timing factor because every time you have a cycle, you have eggs that release or an egg that releases. And with the AMH, they can't guarantee how many exactly are left. They could just get an overall number, like generalized number for your age and the blood sample, right? There's no method to see how many exactly you have left. They don't seem like they're alarmed, and it's not in the very low category. It's just in the lower for my age range. So, it's not like panic, panic, panic. If that were the case, like we don't know how many eggs you actually have left. If that were the case, they would say we have to go towards IVF. And they would also be doing a blood draw to see what the quality of the eggs are. Because IVF, from what I understand from friends who have gone through it, you can retrieve eggs, but if they're not of XYZ quality, it's very difficult for that whole like implanting process that they do to then go back inside you.
They can get an idea on that with a blood test?
The quality?
Yeah.
Yeah, they can do that with a couple of them.
We should do that on our own.
They will prescribe that. Again, they don't think it's a quality issue.
Yeah. I guess just to know, though, I would imagine.
Sure. Yeah, and it probably is one of the tests that they pulled for me. I would assume it's on one of the markups that they would have initially done right when we first started this whole thing, just as a standard practice. But it's just not one of the numbers that I have, or one of the blood draws that I've been like Bibling on, as like, okay, I know this is like a really guiding pillar for us.
Yeah.
So again, these people do this day in and day out. And for the short time that I've been going through this clinic, they've treated me very, like they're all very personable there. So I don't take it as like they're getting patients outside of, they did email me somebody else's information, but that was the coordinator. But, the doctors have both been very personable, very like, I can tell that they care on a very deep level of like, this is people's hopes and dreams and futures and, they're like the biology thing that we talked about, right? Like yearning for having kids and stuff like that. Like they don't take that lightly, and I can tell in my encounters with them. So, if there was something to be said, I don't see them pussyfooting around anything, in the sense of like, this is you wouldn't be here if it wasn't serious type of thing, they don't want to waste anyone's time. So, I feel like I trust them. I trust their judgment. I trust their, like I said, they, who knows how many women they see a day.
Yeah.
And they're open 364 days a year. So seeing a lot of mamas in there.
Yeah.
They also seem to think that given we have 2 healthy babies, boys, that are very young, they, when I went in there yesterday, she was saying that that's all huge indicators of like, this is, your quality of eggs don't just drop dramatically in 2 years, even a year. Definitely not a year, but like 2-3 years.
Yeah.
So knowing that we had 2 beautiful boys back to back, and we got pregnant twice back to back, and then it's like these are clear indicators to them that this is not a 911. We need to save every egg that we need. I think maybe in a year.
So August is the first time we tried them, right? So we could try a month after the procedure.
It's not clear to me if we can't try right after, because I did a little research yesterday.
September.
Oh, hold on. And honestly, for a healthy baby,
Yeah.
you know, doesn't matter. We talked about this being our last and being okay with that. If we get one more after this, that's great.
Yeah.
Right? But we did talk about this and not putting the pressure on ourselves.
Yeah. Not that. It's just I don't want I have a sensitivity with the boys with there being too many years apart, like each longer.
Yeah, but
Each
what's a
month.
couple months, right?
Yeah, I know. I just doesn't change how I feel about it,
Yeah.
this months or not.
What's your driving factor around that, do you think?
Well, I don't know. I think there's a multitude of reasons, but still, I mean, that's just like that's what's on my mind.
Well, IVF wouldn't change that. IVF, I think, would be longer because you have to go and do egg retrievals and you don't know how many you're going to get. It's a very painful process. It's actual surgery, right? And then whatever the steps are for fertilizing the egg, and then I don't know, just to go back and like, I don't know that whole process, but I imagine it's not a 1, 2, 3 all in one cycle thing, or maybe it is. I don't know, but it's way more invasive.
Yeah.
Right. And so this is the ideal state for us, knowing that I've had healthy pregnancies, full-term pregnancies, no issues really leading up to getting pregnant. This is the first blip,
Yeah.
and it's not, I think, indicative of like carrying a healthy pregnancy and things like that, that sometimes people require with IVF, in the sense of, is it a healthy sperm? Is it a healthy egg? Can they survive? And then there's like monitoring, invasive monitoring, and not like, we don't need that. Or maybe we do. I don't know. I just don't think so. And neither did these people. So
Just the waiting game is really hard.
I know you've been super moody.
Well,
Since
I mean,
for like before, and then since we found out, I think it's been definitely taking a toll on you. But I think you need to do a lot of research, because I think you were maybe over assuming a few things that maybe I got reassurances on that you didn't, because you weren't there. And like, maybe you just need to think through that a little bit, because I feel, while I don't feel good about the situation, I feel more at peace. Like, this is the best that we could have hoped for in this situation. It would have been awful if we went in and they're like, there's nothing here. Now we really don't know what's causing this. Let's do surgery to figure out if you have your endometriosis is causing this. And then, they go and biopsy that. And then, you know what I mean? Like, the further waiting game. And while we're still trying and maybe conceive and then have another loss, you know what I mean?
Yeah.
I think that this is the best case scenario, because we at least have something that we can cling on to that's very common, very standard. Usually, like 9 out of 10 people go on right after this to get pregnant. Actually, my dentist told me that she had a hard time conceiving, and then she went and she found out she had 2 polyps. She got them removed. The next month, she got pregnant, and she was 4 years old.
So it was the next month.
It was the next month. Yeah. But that could just be because of when she timed the surgery. Like, you don't know, right? Because I'm sure it's, once you have the surgery, you probably can't do anything for a couple days, right? Much like the water sonogram, right? They said no sex for 2 days, or
No swimming even,
no
right?
swimming. Yeah. For cause of infection and things like that. And so it's probably high risk, in the sense of you don't want any foreign things. And like, if there's potential scar tissue or whatever, right? Inflammation from, I mean, they go in and they literally like laser off the polyp. What they explained to me is they like go in with a camera, then they put in like this like laser lasso thing, and they put it over the polyp, and then they cinch it off. And so as it like cuts it off, similar to like a mole removal. It cauterizes
Wow.
the wound right then and there. And yeah, so, mhm,
Wow.
and that's in the uterus. And so they want to make sure that that area is nice and healthy. And so it may make sense to do it the month after, just to make sure that that's a very healthy and like not a weird
Yeah.
environment. So,
Yeah.
anyways,
And the endometrium. What is?
endometriosis.
Yeah. What's that again?
Endo is what I think it's probably like 4 out of 10. Maybe that number is higher, but women have it. It is common with like PMOS and other metabolic things where your body produces too much estrogen, or maybe has insulin resistance or lots of inflammation. It's essentially inflammation in the uterine cavity, as well as could be in your ovaries and things like that, just in your reproductive tract. And it causes really painful periods, heavy periods, pain with sex, things like that. It's a lot of inflammation down there. And it's all internal on your internal walls and stuff. And it just is like a really inflamed area. So, the tissue is 2 to 3 sizes bigger than it should be, and creates its own issues, right? Some people have such bad periods they can't even get out of bed during their whole period.
Yeah.
Right, and that's like a really serious form of endo. Yeah. So with that, it just causes an extra layer of me leaving a very hostile environment, which they won't know until they actually biopsy the polyp. But I was told they would be able to see, hopefully with this scan, if there's inflammation. And then my doctor did tell me what they could do is they can give me antibiotics for 2 weeks that kind of clears out the inflammation. That's temporary, because endo is, unless you get surgery, like it's not treatable, the inflammation part. And so, but it's a temporary fix that will cause it to be a much more hospitable environment for implantation. And then once the implantation's done, it's kind of like, it's okay, because that's the most fragile part of conceiving. Yeah. Well, I've learned so much in this past 2 years.
Yeah.
And then specifically in this past year. Yeah. And it's crazy with all of like these problems, endometriosis, PMOS, like it's so difficult to get a diagnosis for this stuff that a lot of women have to go and, like I did this last year, right? Really advocate for myself and be like, I know that things are wrong, like especially being postpartum. I never had PPD or PPA and things like that, but I had physical symptoms of not feeling like myself, and just the inflammation all over my body was just insane, and feeling like a prisoner really inside of your body, and like trying to do things to help it but not getting anywhere, and actually making the symptoms worse tenfold. And it's very frustrating. And then to go and explain that to a doctor, and then them run labs and say, well, your labs are perfect. And it's like, you're fucking joking me. Like, I know something's wrong, and so it's really sad that a lot of women, these are kind of like the calling cards for like our hormone health being off, but there's just not a lot of education or literature to help people understand what that is. And then for, I think, a lot of doctors, there's not a lot of I don't know if it's like buy-in or what, but there's not a lot of help on their end either to say, this is exactly what's going on with your body. This is exactly what's probably the cause. And so you have to self-diagnose. And then, of course, doctors get mad at that. They're like, get off the internet. And it's like, well, something's got to give, And I was lucky enough to finally find, through a women's health specific telehealth, a functional doctor who also was an OB. And she was like, oh, definitely, you have PCOS at the time, then changed PMOS. And that's when I got in the GLP, and almost all my symptoms started disappearing like that. So anyways, it's just very frustrating because it's like, how many women are walking around with these things unknowingly and just thinking like, well, this is just luck of the draw for me, right? This is how I have to go through life, and, have to be 50 pounds overweight just because my metabolic state doesn't know how to convert insulin and things like that. And like, it is what it is, right?
Yeah.
It's just, yeah. And then with PMOS and endometriosis, infertility is like number one, and it's just really sad that, people are told, well, the only way to cure it is to get on birth control. And it's like, well, I don't want to get on birth control because at some point I want to conceive. And it's like, well, give that dream up because it's not possible with your diagnosis. So there's just so much mixed information out there,
Yeah. Yeah.
So, yeah.
Okay. Yeah, maybe we just send a message tonight and then we can call tomorrow.
Yeah.
Go inside. Want some signing? I brought drumsticks in.
Okay.
Okay.